Niaje, karibuni. Hii ni Doctor's Practice, tuko hapa Hill Park Hotel. Mabese zangu, Daktari Wanjohi, fellow iko area, nutritionist, daktari of course, or a gynecologist, Ade wa insurance, Carol nurse. Nianze na nani? Wacha tuanze na daktari because nataka watu waweze kuelewa hii issue ya infertility. Una vile si blame kina mama. Mpaka vile Carol amesema unaomba enda uende mwingine juu huyu hawezi. So iko na issues na tuweze kuelewa kama kuna treatments, the various treatments ambazo ziko. So mtu ujua aje?
First of all, kwa society kumekuwa na pressure mob sana. Kwa wase especially wakisha kwa tuseme adole kituka hiyo kujua kama wataweza kupata watu in the future.
Yeah.
So you find a lot of people engaging in a lot of risky practices. Wow. So ni vizuri sana wase wajue first couple lazima ikam pamoja. Ili tuseme mtu ako na shida ya fertility, lazima kuwe na chali na lazima kuwe na dem.
Right.
Sasa wakuwe pamoja, waishi pamoja for 1 year where they have at least 3 to 4 times per week.
Hiyo ni yani hiyo ndio ujekao utapata mtu ya
hiyo sana ni prescription ya kijamii 3 to 4 times.
Okay.
Sasa kuna watu wengine tuseme mmoja anaishi faa, mwingine anaishi faa. Hizi lifestyles zetu saa zingine tunakuwa too busy. So mtu anafika home midnight, anatoka home 6, so unapata hakuna hiyo time ya kuengage. Sasa one of the prescriptions ni kuambia tu msee slow down, rudi tu home, ingianga home mapema, have time with your loved one. Mpige story, tuone kai kitu itawezekana.
Okay.
And then
so
kutoka hapo the investigations, first of all we just use take a complete history, then we do a physical examination.
Okay.
Saa zingine
what does that entail? Physical examination?
Physical ile ya kuangalia mtu kama tuseme mikono, kama kuna damu ya kutosha. Those basic things, tuseme blood pressure iko juu.
Right.
Skari, vitu kama weight, kujua vitu kama obesity siku hizi imeenea sana.
Ina affect reproduction health?
Ndio sana.
Obesity?
Ndio, kwa sababu obesity and they are linked with cardiometabolic diseases.
Right.
Yes, kama pressure na skari, heart disease. So zote tunataka kujua kwanza kijumla before we go to the reproductive organs.
Okay.
Sasa ikifika kwa reproductive organs tuna test zingine tutafanya based on what we see. So saa zingine tuseme for some ladies tuseme watakuwa na issue na hormones, like the most common inaitwa polycystic ovarian syndrome ama PCOS. Sasa hiyo utapata a lady ameanza kupata a lot of testosterone. So unapata manywele zinaanza kugrow kama kidevu nini, tuseme nywele inakuja kwa kifua, then anaacha kupata hii hedhi ya kila mwezi. So hizo zote sasa tunataka kufanya more tests kujua kama kuna shida. Ndio.
Kuna hiyo issue. Manake ndakawe unajua ndio mtu kutana nao. How does culture affect?
Yes,
how bad is your effect ya culture kwa hii story?
Yes. So I wanted to say, as Dr. Wanjohi has said, kwamba this is a couple who've been there having intercourse for 1 year and there's no baby. Yeah. So even as you take your history, there are some risk factors. Smoking is also one of them. Over drinking is also one of them. As I said, weight is also something that you need to check, because those are some of hizo ndio vitu ambazo zitakuelekeza kwanza kuangalia shida inaweza kuwa ni nani kati ya hawa wawili ambao wako hapo. Because the first thing ambayo watakwambia ni kwamba tumeishi pamoja mwaka moja na hatujaweza kupata mtoto. Again, age, yeah, we normally say 35 and above, and for the last 6 months umejaribu kupata mtoto haujaweza. Again, we go further because quizi 35 is neither here nor there, so tuseme 40. At 40, you know, at that point we say now fertility. Yes, so all those things put someone at risk. So you need to know the risk factors even before now we go to the major test, which as Adelaide has said, they are very expensive, because even to check the hormone level, you have to draw blood, you need to check the semen, to count the levels and all those things. Now for also, he talked about the woman. I want to talk also about the man. Because for the woman, you'll be growing hairs. For the man, you'll not be growing hair. Huh? And so you're wondering also why you're not growing ndevu, you know, breast, maybe you're feeling like you're also having breast like a woman. Again, going to the sexual reproductive organ, sometimes we say the scrotum is quite reduced, or you know, the testes are very small.
Yes.
So those are some of the things. Or the scrotum is very big, yeah?
Okay.
Again, risks, people who like going for sauna and heat therapy. Yes, majimoto bathtubs, hot bathtubs. Sometimes, yes, it does. Especially for the male.
How badly?
Especially for the male gender. Yes, so those are some of the things which are very important.
So what are we looking at insurance-wise? So there are those issues. Alafu na haujui, unakuja tu ambaye adenda insurance. Ya hii, ni sort.
So the first thing first tutakuangalia kama unataka kununua insurance ya whatever kind, lakini nitasema tena kama disclaimer, maternity kama umekuwa successful, it's not considered an insurable risk. This is a natural process of life. You're expected to have the child as part of being human. Lakini utapata some of these costs are usually quite high for couples. Na if you can say, it has also been a societal push. Siku hizi watu wanataka wanataka welcome huyu mtoto under very grandiose moments, kaka trumpet, sijui nini, very beautiful rooms na vitu kaizo. So umepata sasa the costs of actually maternity in most of these private hospitals zimeinflatiwa, and it's not really due to the process of natural birth, because natural birth, once you have a midwife and a douala, should be sufficient if at all there's no complication. Lakini utapata sasa kumekuwa na a lot of societal pressure through the whole process. In fact, wacha tu hata just the birth itself, hata through the whole process of prenatal care, watu wanataka very high established kind of scans. Some people hata wanna go overboard with the 3D. The scans should.
Now there's 4D.
Yes, there's even 4D, and there's all these professional kind of things, and you unataka kupatia watu every month a status update of what's happening in the images. So unapata the whole maternity process is beginning to look very, very, very expensive, and it's becoming extremely commercialized. We are grateful, especially for the low-income segment who are not really
into those things.
Into this. The government imeingilia na at least maternal health is significantly cost efficient, if not free. But of course there are also other underlying challenges that come with that. So utapata ya kuwa at some point nilikuwa nimeambiwa nimenunua insurance ya inpatient na iko worth 2 million shillings. Na vile nilisema, maternity is not an insurable risk. 50,000 should be sufficient to actually cater for that cost. Kama unataka grandiose process to welcome your child, basi uta have to go out of pocket. On top of that 50,000, siku hizi tunai push up to 100,000. Kuna some medical schemes which does not even allow for a limit, but there's just so much you can, and as I say, it's just commercialized and artificial costs that are built into that. Lately tumeanza kuimprove, and because of statistics yenye inaonyesha quite a significant amount of infertility, sasa insurance imeanza kuwa na a lot more push kuona how these young women who are trying to conceive and are unable to. Because ukiangalia the options available for infertility treatment, IVF, it is quite expensive in intravitreal fertilization. So unapata hizo costs zinaanza at around 300,000. Zikipanda juu na juu kabisa. Now pia imeanza kuwa commercialized because IVFs, as we call them, has a higher chance of people twinning. Na unapata mimi nataka watoto wangu wawili na nawataka saizi mara moja. So utapata sasa hizo strains pia zinaanza kuingia kwa community. Mtu anataka mtoto mara moja. Your body perhaps was not built for that kind of that kind of situation. Na pia ni expensive. So yes, there's quite a huge impact on insurance when it comes to reproductive health. A lot of it, as I believe, and could be also just a personal thought, has been driven by society, has been driven by all this commercial sense of how to welcome in. Because trust me, many centuries we have survived as humans. Na hakukuwa na insurance, hakukuwa na grand unaza tu mtoto, as long as hakuna complication. Should be.
Maybe I will talk much on the prevention. Heart disease, blood flow is also affected. Hypertension also with the blood flow affected. Obesity now, a lot of fat accumulation in a block zile veins. So know your weight. Mwanaume wewe unapiga mayai 6 daily, mi upenda mayai. Ina create a lot of fat in a block ile samo. So avoid anything that will lead to cholesterol. Physical exercise. Circulation of blood need to happen so that uko fit. Apart from that, ukiwa stressed, enda counseling because stress itaku affect. Utaenda pale uko na stress, huwezi function. Unapata mtu akikunywa pombe, akikunywa pombe ndio yata function. Now happen, but at the end of the day that pombe is affecting you. So stop alcohol. Sigara, what will it do? Harden your nerves and veins. Circulation is impaired. So physical fegi in hizi vein unapata unaweza katika mguu because hakuna blood flow. So hizo cells zinaanza kudie and several other things. So kata fegi eti mogoka watu mogoka na bigina njugu inaingia poa. Hizi vitu inaku affect. Haikusaidii. What is affecting you in sexual life is your mindset. Ndiposa unapata kwa nyumbu function lakini ukipata mayeng buda we ilikuwa poa ndio unapata mzae pesa yake inaenda tu mayeng lakini anaweza function kwa nyumba ni vile haja set up mind. So go for counseling if these things are not working.
So when determine when kuambia mtu okay, sasa umeshindwa hii game imeisha, tuingie tu artificial technologies. Na ni gani ndio mzuri for wengine? Mwana vile Adam amesema yani tuache tu TV. Tuache celeb mwingi hizi sijui raga when do you determine this is good for you because of certain weaknesses or dysfunctions in the system?
So those tests are the ones that will help us to know who we can be able to help using maybe medication, who we can be able to help using maybe surgery, then who we cannot help using medication or surgery. Those are the ones we push to assisted reproductive technologies. By the way, sio IVF peke yake, kuna nyingi sana. So mtu akikam ndio tunamrun through kulingana na ile aspect yenye ameshindwa nayo. Yes, tuseme ikiwa tubes are blocked, so we know the egg and the sperm can never meet. So now we have to, that's something like IVF. But if it's something like tuseme the sperm count is low, then kuna madawa kama umesikia kama zinc, a very simple supplement, hata vyakula, mtu anakula vizuri, unaona sperm zinaanza kuflow.
Kuna swali nitakuuliza lakini hiyo acha tutauliza mwisho kabla tujafunga lakini kuna hii. So when all fails maze actually no. So kama jamaa yake imekwisha, it is unasema zote ni treatable if a man is suffering from erectile dysfunction anaweza treatiwa hata mama. They can be treated. Okay, so but then kuna ile aspect ya in case kuna hizo challenges, surrogate mother. Carol.
Yes.
Talk to us about it. Surrogate motherhood.
I think surrogacy is something that is not new to us. We used to hear of surrogacy, and I think being African culture, we tend to judge so much.
Sana.
Kwa nini? Yeah. Yet we are the same people judging them kwa nini hawajapata mtoto. Yes, so it is neither here nor there. But at the same time, surrogacy is there. We have different companies that are there in Kenya right now. Yes, okay. We do have. We even
in this
have
place where you're judged like that?
Even just here in Upper Hill, I know there's a doctor who does quite a bit of that. We have different companies which are there.
And it is legal?
Yes, there are forms that you just have to sign, consent forms, where it's legally binding for you and the surrogate person, so that there are no complications in regards to that. And I can tell you, even for a fact, even for us where we practice, we've seen mothers who've come and they are surrogates, and they even come with the people who they are carrying their child, because being a surrogate person, it means that I've offered myself to carry maybe Adelaide's baby.
Lakini hakuna emotional connection, wewe unabeba mtoto, sio?
No, okay, it depends. It is all in the mind, number one. Number two, it depends on how we are relating with Adelaide.
Oh.
Yes, because even before I decide to carry Adelaide's baby, then we have to sit down and agree on the terms and conditions in regards to me carrying their child. Sometimes it can also be abused, whereby I just want to make money because I'm very poor, and Adelaide is offering me 5 million.
Yeah.
Yes, different companies have different costs, because you're dealing with an agent. Yeah, so you have to go and agree. Again, if those terms are not okay with you, then you're good to refuse and say, no, I will not take this. Yes. But as I said, it could be a way of also someone can abuse. The same way sometimes you hear people joking, I want to sell my kidney so that I can get some money. Yeah, so someone will also say, I'm very ready to carry a pregnancy. But then in Africa, we are very fertile. If you compare, I think most of the statistics, I think in Africa, we are more fertile than any other place. So someone may decide, okay, I want to use you as a surrogate. Well, if you're comfortable, you sign a consent, I think it is okay. Yeah. And we need to reach a point whereby we are not judging people so much.
How bad is that currently? Hata kama ni legal, but the means kujua ni legal Kenya.
Yes, it is.
But how bad is it? Because of the fact that I don't think many people know it is even in existence over Kenya. How?
It is there, and I think even the people who are actually doing, most of them have actually tried to put it on social media and so many other places, yeah? Because again, I go back to, it has to be legal. Everything has to be legal binding. So you have to andikisha hizo vitu zote. Yes.
Pana, for now.
Kumesema mbeleni hii story ya kuna cover lakini tuongee.
Kwanza surrogacy kwanza. Hapana, hiyo mna push sana, mna push to the wall. Hapa nisiwadanganye. Lakini hata if you have to think about before niende into insurance kabisa ndani. We can't forget to ignore that African culture pia tulikuwa na our own traditional ways of surrogacy. I mean, in many communities that we are aware of, it was okay for a woman who felt she was barren to actually bring a second wife to the husband or a sister to actually help the husband to continue. So I think it's something that either is not to be shied upon, because we did have those infrastructure. Tulikuwa nazo. So surrogacy, apana. Tuna insurance product ya surrogacy for now, because I can imagine this. Mimi pia, because I have 2 children, na ningekuwa na choice ya kuruka hiyo story. So you can imagine a whole population of people who are, because of the abuse that can occur. Yes. But it's something I think that should be respected, nurtured, and understood that we did have it in our own form and culture some years back. Yeah.
Daktari.
I wanted to add to the issue of surrogacy and assisted reproductive technologies, is that there are quite a number of instances where people don't want all those issues. So a lot of the time we are directing people towards adoption. Like I remember the first experience nilikuwa nayo with this issue of adoption. It was a lady, very beautiful, you can't tell akona shida yote, lakini aliumbwa bila uterus. So apati hedhi, so when she was concerned,
alizaliwa bila uterus?
Yes. It happens. So it didn't form in the womb, in the body, it never formed. There was no uterus. So unapata, that lady, she came to me when she was 25 years, and she just came with adoption papers for me to sign. Sana kamuliza, we ni supu sana, tafuta chali, mbona una adopt mapema hivi. So akasema, mi nizaliwa hivi, so mi nisha I've come to terms with it. Mi wacha ni adopt mtoi na tuendelee na life. So a lot of the time unapata watu wengine ukiwaambia ati utahitaji sijui tutoe sperms tuzieke pale, yai tuweke pale.
Anasema Z.
Yes, anasema Z. Wacha ni try route ingine. Yes, cause hao watu hii pia wanahitaji wazazi. So pia wanaweza tukiwachukua tunawa big up. Si ndio?
Break kidogo, tukirudi tutaendelea. Kuna swali nataka kujinyanyua wawili, menstrual cycle.
Mbona machali peke yake?
Alafu kuna ingine. Wacha turudi, we take a break, tukirudi more questions in as far as this, and also treatment kama kuna yote, na contraceptives pia. Msiende mbali, tunarudi.